You're exhausted all the time. You get dizzy when you stand up. A short flight of stairs leaves you breathless. You blame stress, lack of sleep, or being out of shape. But what if your blood is struggling to deliver enough oxygen to your body? Anemia isn't just low blood. It happens when you don't have enough healthy red blood cells, or enough hemoglobin to carry oxygen effectively. Hemoglobin is the oxygen-carrying protein inside your red blood cells. When it's too low, less oxygen reaches your tissues and organs. Your brain needs oxygen. Your muscles need oxygen. Your heart needs oxygen. So when oxygen delivery drops, your body notices. You may feel exhausted, weak, dizzy, or short of breath, even during activities that normally wouldn't bother you. Watch for the clues: unusual tiredness, weakness, pale skin, dizziness, headaches, difficulty concentrating, shortness of breath, cold hands and feet, or a racing heartbeat. And here's the problem. Mild anemia can develop so gradually that you start thinking feeling exhausted is normal. Here's something important. Anemia is a finding, not a single disease. You can become anemic because you're losing blood, not producing enough healthy red blood cells, or destroying them faster than your body can replace them. That's why finding the cause matters. Iron deficiency is the most common type, often caused by blood loss, increased iron needs, poor intake, or poor absorption. Vitamin B12 or folate deficiency can produce abnormally large red blood cells. Sickle cell disease changes the shape of red cells. Hemolytic anemia destroys them too quickly, while aplastic anemia occurs when the bone marrow fails to make enough blood cells. Your risk may be higher if you have heavy periods, are pregnant, have gastrointestinal bleeding, kidney disease, or another chronic illness, have difficulty absorbing nutrients, follow a diet low in certain nutrients, or have an inherited blood disorder. But anyone can develop anemia. If you think you have anemia, don't just start taking iron. A blood test can check your hemoglobin, hematocrit, and red blood cells. Depending on the results, your healthcare provider may check ferritin, iron studies, vitamin B12, folate, reticulotodes, or other tests to find out why you're anemic. Treatment depends on the cause. Iron deficiency may require iron-rich foods and iron replacement, but the reason you became iron deficient also needs investigation. B12 or folate deficiency requires appropriate replacement. Internal bleeding must be found and treated. Severe or symptomatic anemia may sometimes require a blood transfusion. There is no single treatment for every anemia. Food matters too. Iron can come from foods like meat, lentils, beans, tofu, leafy greens, seeds, and iron-fortified foods. And pairing plant sources of iron with vitamin C-rich foods can improve absorption. But remember, food alone may not correct significant iron deficiency anemia. Severe anemia can become dangerous because your organs still need oxygen. Your heart may try to compensate by beating faster and pumping harder. Seek urgent medical attention for severe shortness of breath, chest pain, fainting, a very rapid heartbeat, or signs of significant bleeding. So if you're constantly exhausted, dizzy, unusually pale, or breathless, don't automatically blame your busy life. Get checked. And if your blood test says you're anemic, ask the next question: why? Because anemia is often a clue that something else is happening in your body. Listen to your body, know the signs, find the cause. This is Health Unfiltered, where we make health make sense.